Hi, my name is Steve Davalos, and I'll be talking to you about the Affordable Health Care Act, and we are arguing that it should stay. Now, she had made some important points. First off, that healthcare is indeed the most important thing here. Now, healthcare is not a product. It is not something that is tangible necessarily. It is a protection in the inevitable that something does happen to you, that something happens to your family, your wife, your kids, yourself, and that you never saw it coming. So why, it is a very expensive price, that is indeed true, and there will be a lot more taxes that are implemented, but should money necessarily count to the life of your children, to the life of your friends, to the life of your husband, to the life of your wife? Is money really a limiting factor here? Now, the war in Afghanistan in the past decade has cost $6 trillion to the United States. Now, this is over the course of a decade, of course, and the equivalent would be $75,000 for every American household, according to Harvard University's Kennedy School of Government. And the cost of affordable healthcare will be around 1.36 to $2 trillion estimated. Now, that's an expensive amount of money, and many people may argue, well, we can't afford this. However, you can't afford 2/6 of what the price of a war for the past decade was, and yet we've already been able to afford that on killing people across the country. So yes, it is possible to afford this. It is not something that is completely going to bankrupt this country. And in the matter of debt, yes, this country does have debt, but that's how economics works, unfortunately. Now, she had mentioned that there's going to be tons of new taxes. However, these taxes are being put in place because now the money that would have been going to individual companies is instead going through the government so that they can pay the hospitals themselves by having the government work through getting the average American cheaper price for healthcare. Now, yes, there was prior options before this was enacted in 2011. Those cheaper options for coverage in which, hey, I've had healthcare for the past 5 years, now you're giving me a new type of healthcare and it's going to cost more money. I thought this was supposed to save me money. However, in a New York Times study in 2010, Dr. David Himmelston, who is an associate professor of medicine at Harvard Medical School, pointed out that in the year 2009, 1.4 million to 1.5 million of the bankruptcies filed in the United States. Of those 1.5 million, 67% of those were because of medical bills. 67%, that's over half of those bankruptcies in the United States. 2 million people, that's 1.5 million people who went bankrupt because they couldn't afford their medical bills. Now, however, it sounds like a lot, and it is, but it's also worth noting that 2/3 of these people already had health care. This is the health care that, what they want, we would have to go back to. So 2/3 of the people who did get damage via, maybe they got their finger sliced off, maybe they got hit by a car, maybe they got, maybe their heart had, maybe they had some fat that got stuck in the heart and they got a heart attack. 2/3 of those people could not afford it and they went bankrupt. Now, of that group, it is also worth noting 2/3 of those people went bankrupt, and now if we have this enacted, which we currently do, that number would dramatically drop with people that would no longer go bankrupt. She also pointed out that people can't really afford it. And that is true. But she also pointed out that this would raise at a cost of $2,000 per family. But it is also worth noting that prior to this, many people did have an 80-20 plan, which according to Kaiser Permanente, most insurance plans do not give you a blank check for medical services. This is a good point. Why would they just say, anything that happens to you, we'll cover all of it? So what happened was, whatever happened to your medical expenses, 80% of it, you would have to pay 20% of it. That does sound reasonable. However, it's worth noting that if you had gotten your arm damaged, if you got it broken, as that happened to many individual people across the country, you could be faced with a $6,000 medical bill because you broke your arm. $6,000 prior to this being enacted is only 3 times the price of what it would currently cost. If you currently to afford healthcare, it would cost an extra $2,000. That is true. Prior to this being enacted, If you broke your arm, you could be faced with $6,000 in debt that you didn't have. So this is indeed saving you money. On top of that, one of the problems is that in the medical industry, this is an industry about making money in the United States. And recently, when a family went to the hospital, they received a bill for her child who got damaged when she fell off the swing set. And the price of this, and the price of stitching, as well as the glue, as well as some pills, came out to $2,229. And the glue itself was $1,696 with that charge. Now the mother was completely in shock. And according to another New York Times article in which they're looking at the hospital prices that were soaring in 2010 to 2011, the medical system is notorious for inflated bills and inconvenient high prices. $2.7 trillion is spent every year in the United States on healthcare bills alone. That price, the money that went into healthcare alone this year, dramatically overshadows the actual price of this coverage that would be covering Americans now. And to the sense that, yes, it is a lot of money. Yes, it's a lot of money that to many people they may not have. But now you're being covered so that you don't face the possibility of being bankrupt because maybe you broke your arm, maybe you can't work. Now you're being covered. Now you're being covered in the face of accidents that you can't see happen. And also now, even though you may not have been able to afford it before, now you can because more people are being covered, up to the point of 10 million extra people that have been subscribed this past year with the enactment of the Affordable Health Care Act, that prior to this were not being able to be accepted because they may have had pre-existing conditions, because they may have been born with a birth defect that they had no choice of, as opposed to people who maybe smoke for 20 years and then they get lung cancer. They had it coming. What about that child that was born that child that was born with asthma? Now they're going to have to pay for that. That child was born with a congenital heart defect. These pre-existing conditions, insurance companies would not have allowed before. And now things like that are allowed. Now they are covered. Thank you.